didn't he give the then health minister the money when he was the finance minister? Yeah. He did. And now that he's the health minister, how can he guarantee you that the fact Arlene Foster is going to free up the money? So it's jammed tomorrow, I'm afraid, and I have little faith that in fact it'll arrive.
Well, today is an opportunity for unions, staff side organisations within the health service to allow workers within the health service to vent their anger at what they see as the total disgraceful treatment that the department, the minister, health officials have had for them, both in terms of staff morale, both in terms of their pay, both in terms of the lack of engagement, probably exemplified by today with the health minister making an announcement about further restructuring within the health service, but no engagement whatsoever with ordinary staff and workers. And indeed the Donaldson report that gave rise to today's announcements, there was absolutely no engagement with staff side. They have shut down negotiations with their staff representatives, with the unions. They have stopped the partnership forum. Staff are now feeling that they're working on terrible terms and conditions in terms of increased staff. The morale has never been as low. The working environment has never been more dangerous in terms of the patient to staff ratio. And just totally disgusted at the treatment that they've been at the receiving end of. And today is about trying to get that message across to MLAs and the executive and the wider public.
Well, 14-15 we didn't get a proper pay increase. It was done in bits and some people got nothing. What we're saying is that needs sorted out. But this year's pay claim, we've put in a pay claim. We haven't even had a response from them. We had the hokey cokey minister set a date in the diary and he wasn't the minister on the day that was supposed to happen. So did he rush to replace that date? Not yet, he hasn't. So we say, come on minister, get yourself sorted and come and talk to us about pay. Pay is important to our workers.
Workers have seen a 15% decrease in their spending power over the past 4 to 5 years. 1% is a very, very modest pay rise. And think when they don't get that, they're thinking, are we valued? Are we appreciated? And the thing is that staff will go to places that are given this 1% and in some cases 2% in Scotland. So what we'll see is an influx of staff over to England, Scotland and Wales. And we will be left with staff shortages on the ground.
Oh, absolutely. People are seeking alternative employment or seeking to earn money in other ways because they simply can't sustain the long hours, the stress, and basically morale is low and they feel undervalued. And it's very hard when you're a highly motivated group of staff to keep working the long hours without having the value of being paid correctly.
Well, look, one of the biggest ones is change, and you'll have heard today that the Minister plans to reshuffle the health service. The only constant in the health service is change, and our members are well used to managing it, but it does put pressure on them. There are now people who will be saying to me today, is my job going to go? How can we? And we won't be able to answer that until we get into some discussion with them. So there are a lot of pressures on the service. You'll know from waiting lists, all of that. The waiting lists are not created by our staff. They're managed by our staff, and we do our best to ensure that those are reduced.
Unite have been suggesting that they're going to push ahead with perhaps a ballot towards maybe further strike actions. Do you think is this something that is there a likelihood that we could see more strike action in the near future?
I think it's highly likely, but the question really has to be asked is, can we coordinate that across all of the unions, all of the health service professionals, either through the Irish Congress of Trade Unions or unions working collaboratively, because we are all in this together. So I think it's only logical that if we fail to get any of these matters resolved, then I think a united front in terms of industrial action is the only way to proceed.
Well, the bigger issue here at Stormont is the fact that where is the health budget? Mr Hamilton is at a conference today sending out statements about how he hopes to change this. This is an immediate problem. This pay rise should be given, and it should be given now. As well as the difference in pay, what's going to happen is we're going to lose our experienced staff to places like Scotland. And what are we going to replace them with?
Well, look, I think one of the big concerns we have is what's going on in the health service. The health service is being strangled. It's being strangled by government. And what do I mean by that? Well, what I'm saying is it's being underfunded, where you and I might take the view, well, you know what, private healthcare is so much handier, I can afford it, so off I'll go. And we live, essentially, if enough people do that, they will say, well, there's actually no need for the health service. You'll have closed it down yourself. You and me will have closed the health service. And that's not the way to deal with it. This is our health service. We're paying our taxes for it, and we believe it should be sustained. And to do that, you need to invest in it.
Well, we're hoping that Simon Hamilton takes heed of what we're here today to do. Obviously, you know, no healthcare worker wants to enter a strike situation, but unfortunately, that's what we've been pushed to. Take heed before it's too late. Take heed before we have massive staff shortages, because staff are going elsewhere to work, and then what they'll be left with is paying recruitment and retention premiums anyway, so it doesn't make sense. Look at the long term. That's what I would ask Simon Hamilton to do.